One day all of a sudden I had an onset of symptoms. I could never pinpoint what triggered it, where it came from.
50 million, or about 1 in 6 Americans, suffer from autoimmune disease. Autoimmune disorders are the third most common category of disease after cancer and cardiovascular disease. These disorders affect 75% of women and 25% of men. Crohn's disease and ulcerative colitis make up inflammatory bowel disease, or IBD. IBD affects 1.6 million Americans, and the incidence is only increasing. Unlike most autoimmune disorders, IBD is evenly distributed among men and women. 1 in every 5,000 people are diagnosed per year.
Very often they present with similar symptoms, and those are often abdominal pain, cramping, frequently bloody diarrhea is a common one. And it's usually a kind of an insidious presentation, so it's not something that I was fine one day and the next day I'm totally not fine. It's something that's been brewing. They may have been trying to avoid kind of coming to terms with the fact that there's clearly something wrong. Ulcerative colitis always involves the rectum and can involve as much of the colon above that as it wants to, and it does so in a continuous fashion. But patients can present with just disease isolated to the rectum, and then at a later date it involves the whole entire colon. I would say for the majority of patients, however, the disease they present with is what they kind of continue with down the line. Crohn's disease is a little bit different. It can evolve anywhere from the mouth all the way through the anus.
I'd have to go to the bathroom once an hour, and just planning my college schedule around that. I was able to for a little bit, but it just got unmanageable, and so I don't see how I could have even kept up with school or just any daily routine. Like, I really had to plan out my day. Like, okay, if I'm gonna go do this, I'll have to make sure I'm near a bathroom at that point. And just kind of doing that kind of planning just to want to go have fun is just kind of very frustrating. It's embarrassing in this country to talk about digestive issues, which is just kind of dumb. So, you know, don't be embarrassed to talk about it. I was embarrassed to talk to my mom about it, and so it took me a while to go to the doctor and then figure out what exactly I had.
I think it's similar with often a lot of medical conditions. It's fear of the unknown. So, you know, as I mentioned, there can be a delay in diagnosis, and this is typically an insidious onset. So this has been going on for a while. You know, patients don't know what to expect when they have a diagnosis of ulcerative colitis. Often they don't know what that diagnosis means. They don't know if they require surgery, medications. If they do require medications, how often they have to get those. Yeah, I think the biggest financial barrier now in IBD is the cost of medications. All of the medications, or most of the medications that we now use, do have some risk associated with them. And so it's trying to convince the patient that those risks are worth the benefit. And generally speaking, when patients are sick enough, the benefits of these medications far outweigh the small risks that go along with them.
Primary care providers are the first line of screening, and currently there is no standard protocol for diagnosing IBD. This causes delays in proper treatment and often misdiagnosis. There is no standard measurement for self-management, since the approach for treatment must be specific to the individual. Factors are disease severity, anatomic location of disease, previous response to medications, side effects, and comorbidities.
As time went on, the symptoms would kind of get worse, and you hear a lot of people can go into remission with medication, which sounds nice. It's not something I ever got to experience. Just the thought of surgery was just not in my interest, because from what I heard, they had to cut open my stomach, take out the entire, I guess, colon for the most part is what they do, and then you kind of have the bag that you poop into for a while, and I was like, that sounds miserable.
So in our patients who failed multiple medications, often doing a colectomy to remove the colon is really an ideal option for those patients. And there's some patients who just really are determined to keep their colon, even though it might not be the right decision. And so those are really difficult discussions to have with patients to try to help them understand either, I don't think additional medications are going to work for you, or really you've already cycled through all the medications, there really is nothing left for us to try. Surgery is the next option, and trying to help them come to grips with that idea.
He just looked me straight in the eye and he said, if you don't get surgery, you are going to get cancer and probably die, and you have to get it. It was like, that is quite an ultimatum.
Delay of diagnosis is an underestimated problem, leading to long periods of suffering symptoms. Patients and physicians share responsibility for delay of diagnosis. This points to the glaring need for a better system for healthcare providers and patients alike.
Don't buy into the stigma around digestive issues. It's just talk to your doctor, talk to your parents, talk to your spouse, your friends, whoever you need to. And the doctors through the whole thing, you know, people are always scared to go to the doctor, but they're there for you. And you know, if you wait too long like I did, I don't think, you know, me waiting 2 months to go see the doctor initially would have made much of a difference. But you know, you have symptoms of something, don't be scared. And tell the doctor everything, and I'm glad I did. So I had a good experience with all my doctors. I could see how people could just think, this is going to ruin my social life, it's going to ruin my work life, but you know, the medical advances they're always pushing forward, and you know, I know there's all these new techniques for trying to deal with IBD. It's about as normal as I can be. You know, I still work out, I try to be as healthy as I can, and I think for how my body is, I do a good job of that, and I live a pretty normal life, because the best part after surgery is I can actually hold it now. I don't have to rush to the bathroom every hour, so you know, I might feel like throughout the day I have to go to the bathroom, but I can hold it, it doesn't hurt or anything, and I love that. So yeah, it's been kind of a crazy journey.